It's a pleasure to attend this third annual developmental screening conference that is sponsored in part by First Five Ventura County. I'm a practicing pediatrician in Thousand Oaks, member of AAP, local and national. And in our practice, we've been doing developmental screening for a number of years. We were using Denver developmental testing until the first conference that I attended, when the comment was made, "Denver developmental, is that still alive? Should have been killed off years ago," at which point we switched to peds. I'm also a First Five Ventura County commissioner. I was completely unaware of First Five and what it does until somehow I got appointed to become a commissioner, but I quickly learned how much good it actually does. For those of you who are unfamiliar with First Five, Dr. Kendall mentioned some of the services that are provided. It's a great resource. Ventura County First Five is one of 58 locally based commissions across the state. It's funded by the tobacco tax money for the benefit of children 0 to 5. We got our mission statement changed from 0 to 5 to prenatal to 5, acknowledging the importance of the prenatal period also. This money is currently at risk while our governor tries to balance the state budget. I have to stay politically correct, but feel free to boo the attempt to abscond with our funds. The programs we fund are too good to lose. Knowing the critical importance of the early years in terms of lifelong social, emotional, and cognitive development, First Five invests more than $1 million annually on a network of essential services for young children and their families, including community-based health, early learning, and family strengthening services, anchored by 11 locally designed Neighborhoods for Learning, or NFL. We've heard earlier today how poor our developmental screening rates are. First Five is trying to help with that. Developmental screening with the goal of connecting children with needed early intervention services is a key strategy. First Five promotes these efforts, the screening in both the medical and community settings. First Five funds the Landon Pediatric Foundation to promote and provide training for pediatric healthcare providers in the use of surveillance and screening at appropriate intervals using the validated tools. First Five also funds Ventura County public health nurses and health educators to offer ongoing screening and related parent support in the community plus home visits for at-risk families. Families can access these services by calling 211 or through their local Neighborhood for Learning. Parents need an understanding of normative development. The quality of conversations about development that they have with their children's healthcare providers is critical. And I encourage you to look at the Born Learning materials for pediatricians' offices. These have simple, easily understood guidance for parents in Spanish and English, and there's also a Born Learning website with additional resources. These materials are available to local physicians free of charge. About 1/3 of American children entering kindergarten today lack the basic language skills they will need to learn to read. Children who are read to during the first 5 years of life are more likely to develop stronger reading abilities and the ability to listen. They enter school prepared to succeed. First Five partners with the Landon Pediatric Foundation to offer the evidence-based national model, Reach Out and Read. With Reach Out and Read, pediatric healthcare providers, doctors, nurse practitioners, and other providers promote early literacy and school readiness in our offices by giving new books to children and advice to parents about the importance of reading aloud. I hope you'll join us in providing this service in your own practices. Books and program materials are offered free of charge. We know that some families, despite the availability of services, have difficulty navigating the system of early intervention supports. In partnership with Ventura County Public Health, First Five offers family support specialists who can help families access the early intervention services they need, from the initial concerns through school-age transition. Lastly, and perhaps most importantly, we encourage you to connect with one of our 11 neighborhoods for learning throughout the county. The NFLs offer early learning, health, and family support opportunities to children 0 to 5 or prenatal to 5 and their family members. The specific programs of each neighborhood for learning are based on the unique cultural, ethnic, linguistic, socioeconomic, and special needs of its community. And we do have a program for the Mixteco families also. These services are available to all children, but are also great resources in the community for children with emerging or mild to moderate concerns who may or may not yet qualify for early intervention. I said that was the last topic, but I lied. I'm going to throw in a commercial. As a side note, another problem that First 5 assists with is the epidemic of obesity. And First 5 is assisting Dr. Landon and the Landon Pediatric Foundation with an upcoming seminar on obesity and motivational interviewing. This will include hands-on training in motivating families to change their dietary approach and lifestyle. Unfortunately, we weren't taught this, MI, in our professional training, or at least I wasn't. Motivational interviewing is applicable to other conditions as well as obesity, diabetes, heart disease. Returning to today's topic, the importance of understanding developmental guidelines, the importance of reading, the importance of parents being involved with their kids, and any other situation in which you want your patients and families to change their ways can all be enhanced with MI, motivational interviewing. As planned, the seminar will be free, offer CME hours, and is tentatively scheduled for October 1st. And I hope you can attend and tell all your colleagues.